The autonomic nervous system, screencast 2. This screencast will introduce the branches of the autonomic nervous system, which are the sympathetic nervous system and the parasympathetic nervous system. Now, one thing to remember here when we are addressing the two branches of the autonomic nervous system, probably one of the most important things is to remember if one does one thing, the other is going to do the opposite. If we look at parasympathetic, that is going to be the branch of the autonomic nervous system that is predominant at rest. It's quite often called rest and digest. The other branch of the autonomic nervous system is the sympathetic division, quite often known as fight or flight. Sometimes I approach it as life or death, and as we move on through this course, you'll actually see why I say that. Typically, expect the sympathetic nervous system to come into play during times of excitement, exercise, and emergency, specifically when the body is going to try to restore homeostasis due to it failing for some particular condition. Now here, there's a couple of things that I want to point out, and they're going to be based on the anatomical name of parasympathetic and sympathetic divisions. If we look at the parasympathetic, you'll hear it quite often referred to as craniosacral, whereas the sympathetic nervous system quite often will be called thoracolumbar. Those names are coming from exactly where in the spinal cord they're coming off of. Now, if we take a deeper look at the parasympathetic division and look at the long preganglionic neuron and short preganglionic neuron, well, we're going to see that there is a long preganglionic axon and a short preganglionic axon. This means that the parasympathetic nervous system is going to be somewhat limited in what it can actually innervate, as opposed to the sympathetic nervous system. We see a short branching preganglionic axon and a long postganglionic axon. The branching is going to allow what we'll refer to as mass activation and the simultaneous recruitment of various structures that have sympathetic activity. Now, when we compare the two in comparison to what they innervate, the parasympathetic division, its action will be fairly localized. And once again, this is due to the long preganglionic axons, and it's not going to influence a lot of effectors at any given point in time. Whereas the branching nature of the short preganglionic axons in the sympathetic nervous system, that does allow the simultaneous innervation to several effectors. And another factor that we will see is the sympathetic stimulation from the adrenal medulla is going to release hormones, typically epinephrine. So we will see this along the way. Now, as noted before, when we look at the parasympathetic division, its primary role is maintaining homeostasis in a resting state. We've anatomically referred it to the craniosacral region, and typically where we're going to find the ganglia are in two different locations. One is the terminal ganglia, that will be closest to the effector, whereas the intramural ganglia, that's going to be within the wall of the effector. Now here, notice we can see the limited and lack of mass activation with respect to the parasympathetic pathways. But keep in mind, when we look at sympathetic pathways, the targets are going to be similar. And remember, generally, they oppose each other. Now, as noted previously, when we talked about the sympathetic nervous system, think about emergency and exercise. Anatomical identified as the thoracolumbar division. And when we look at the ganglia, they're close to the central nervous system, but very complex anatomical pathways are associated with the sympathetic nervous system in comparison to the parasympathetic nervous system. Now, when we look at the organization, and there's a couple of things here that I'm going to put an emphasis on. I want to make sure that we have an understanding of this, but this is not something that I will assess you on. Specific to where the cell bodies of the sympathetic preganglionic neurons originate. And remember, thoracolumbar. So we're going to see them in the lateral horn of T1 through L2. And here we'll be looking at myelinated axons that course through the anterior roots of T1 through L2, and then a branching of the spinal nerves. We'll have sympathetic trunks and ganglia. There are left and right trunks, and they are on either side of the vertebral column. Quite often you'll hear of sympathetic trunks and ganglia referred to as a pearl of necklace. The string is the axons, and the pearls are the actual sympathetic trunk ganglia housing the cell bodies associated with the sympathetic nervous system. Now, when we look at some additional organization of the sympathetic nervous system, generally only one ganglion will be associated with each spinal nerve. But when we look at the cervical portion of the trunk, only 3 ganglia, superior, middle, inferior, and then we'll actually look at the role of these. Now here we can actually see an overview of the sympathetic pathways, and notice this concept of mass activation. So once again, the ability to activate multiple organs, and this goes back to the nature of the lower motor sympathetic neuron. Now here we can actually see a cadaver image of the sympathetic chain ganglia for the most part, and we can kind of see the same here in this cartoon image. Now, there are some syndromes out there that are specific to T1, or the sympathetic ganglion, and you may have heard of the condition of ptosis. This is something where we see the drooping superior of the eyelid. Meiosis, that is going to be constricted pupil because the muscles that are responsible for dilating the pupil are paralyzed. If we look at anhidrosis, this is a condition when individuals lack the ability to sweat because sweat glands are not receiving innervation from the sympathetic nervous system. Quite often when someone is embarrassed, they will flush on the face, and that is due to the lack of sympathetic innervation causing vasodilation, so increased blood flow, hence the blushing. Now, what we're going to be looking at next are a couple of spinal nerve pathways, and I want to point a couple out in particular. This one, I'm going to focus more on blood vessels. I don't generally spend a lot of time talking about the erector pili and the sweat glands. We will spend a lot of time talking about vascular smooth muscle and also other organs moving forward. But here, what we want to kind of look at is the innervation to blood vessel, and this is entirely sympathetic. When we look at vascular smooth muscle, we will not find any cholinergic receptors. So acetylcholine will have no impact on the state of blood vessels. It's going to be due to the presence or absence of sympathetic activity. Here we're looking at a postganglionic sympathetic pathway, and this is an especially important pathway. And I want you to take note of what parts of the heart are actually being innervated by these neurons of the sympathetic nervous system. We'll see the pacing centers, so the SA node, AV node. So that is responsible for controlling heart rate or heart rate to increase. And here we basically have sympathetic activity to the myocardium itself, and that is going to be responsible for increasing force of contraction. And what we'll find out a little bit later, sympathetic activity impacts both of the factors that contribute to cardiac output, which are heart rate and stroke volume. Here we see the splanchnic pathway, and one of the things that I want to keep in mind here, when we have sympathetic activity to the organs of digestion, it will result in inhibiting or slowing down those processes. We'll come back to that a little bit later. Now, here is another important pathway that is more specific to the endocrine system. And what we can see here is that there is sympathetic activity going to the adrenal medulla. And that is going to be important because the adrenal medulla is the source of epinephrine. And epinephrine is the primary hormone that is tied into the sympathetic nervous system. Now, the next few slides are looking at some of the effectors that are stimulated by the sympathetic division and the action it has. If we look at the cardiovascular system, we're going to see within the heart increases in heart rate and force of contraction. This was addressed previously. Coronary arteries will vasodilate, and kind of think about it, vasodilation, increasing blood flow to the heart. If we look at the impact of the sympathetic nervous system on the digestive system, when we look at the GI tract wall, we'll find that there is a decrease in motility within the GI tract. If we look at the pancreas, this will be responsible for inhibiting the release of insulin, yet stimulate the release of glucagon. If we look at the liver, glycogenolysis, and that's basically breaking down glycogen to make glucose more available. If we look at the impact on the salivary glands, we're going to notice that the saliva produced will be more viscous or thicker. If we look at the respiratory system, kind of imagine that we need to maintain or increase airflow. So unsurprisingly, sympathetic activity to the bronchioles will result in bronchodilation, hence an increase in airflow. When we look at the urinary system, we're going to see the retention of urine, but what the kidney will be doing is release renin. We'll find out later that this is an important process or a pathway that plays a major role in maintaining blood pressure and some other parameters within the body. When we look at the reproductive system, as far as when we look at sympathetic activity, it's going to be responsible for the release or ejaculation. If we look at the uterus and vagina, sympathetic activity will be responsible for contraction of walls of those organs during orgasm.